vertigo. So these people, they've got ringing, they're dizzy. This is a hard disease to live with. It's difficult for them to drive or to get up and get out of bed and to get somewhere. And the thing is, this one is not going to go away. The only thing we can do for these people is teach them to move their head slowly, reduce their sodium, stop smoking, and comply with drug therapy. And the drug therapy only tries to minimize the symptoms. So this is a very debilitating disease, Meniere's disease. They can use pressure pulse treatment that they've got, or a labyrinthectomy. So they would be taking out, this is the last thing, they would be taking out the cochlear portion. And what's that going to do? You take that out and you don't have anything to bring the sound to the nerves. What's to the cranial nerve? What are they going to be? They'll be deaf. But sometimes being deaf in the one ear, it has to get really bad for them to do that, is better than being dizzy to the point, you know, and that they can't handle. A lot of this, the patients get suicidal with this. Acoustic neuroma. There's a nice CAT scan, and it's pointing to the neuroma. Okay, so what's a neuroma? Acoustics for the ear. What's a neuroma? I think we have the same picture. It's a tumor, right? But it's a benign tumor. So the only thing with this is they're going to have ringing ears and over time develop, you know, that hearing loss. They might have some mild to moderate vertigo. Cranial nerves can be damaged that are diagnosed with a CT, MRI, or cerebral spinal fluid. Surgical removal may be necessary. Most of the time it is, especially if it grows. If it's compressing on any of the other cranial nerves, it's a problem. And the other piece to think about with this is it usually develops, or it may be there quite a while before, oh, I've had those symptoms for years and years and years. And they don't realize it until it's already caused too much damage. You're not going to get this from going to the regular doctor unless there's a reason for him to order that head CT. You know, and sometimes somebody may come in with stroke-like symptoms, and we find that they have one of these, because what are we doing? We're doing the CT, so we may catch it. Oh, maybe that's part of their symptoms. Okay? Hearing loss. What are we going to do for the hearing loss of these patients? We talked about part of that already, right? That's when this does not change.
Speak louder.
Speak louder, but nicely and gently, yes.
And face them.
And face them. Good.
Pull our mask down.
Pull our mask down if we have to. Hopefully 6 foot away or so. Hopefully, thank God I had a young patient last Thursday. They said, Sally, just so you know, he's positive COVID now. I said, thanks. He at least wasn't hard of hearing and I had my mask up, but it's like, okay, lots of those things. Okay, so we just have to be aware which population has the most hearing loss. Older age, what was that called, Precipice? There you go. Do you remember in our eye lecture, what is it when you get over 40 and you start having to wear reading glasses? Presbyopia. You know, so you're kind of getting your, what do we want them to do for good hearing? It is good nutrition. Lower sodium, but good nutrition and health maintenance. We talked about how long has it been, is it gradual or sudden? The different ages, of course, is older, exposure to noises. What can you give me an example of something with the patient that you would figure out?
They went to a lot of concerts.
Went to a lot of rock concerts.
Mm-hmm.
Check out their age. Were they a stoner? Do they so drugged up that they didn't know and they had all this loud stuff? Yeah, that's what I did. How long did you do it? You know. So what about their work?
Factory workers.
Factory workers.
Heavy equipment.
Heavy equipment operators. Somebody around lights and sirens. Okay. But there are many, many different kinds of things. Farmers, a lot of different things. What about our military? They've been around explosives, lots of firing. What about police officers? All the shooting and firing that they have to do, just even in prep work, you know, that they have to keep their skills up. I try really hard to get my husband, he finally wears earwear there. I'm like, your hearing's already damaged. Well, it's already damaged. I said, well, it's just gonna get worse, you know. So, yep, so when we go to shoot guns, make sure that he's got his ear protection on as well. Use of ototoxic drugs. I gave you some of those. What is the main kind of antibiotic? Aminoglycosides. We talked about, so ear infections are going to be very painful. Eardrum perforation, you're going to see drainage out, no more pain. Trauma. There is a genetic connection with ear things. All of those. You already know how to do the physical assessment. Psychosocial for the isolation, depression. And we talked about labs and diagnostic. Okay, we're going to make sure, is the decreased hearing due to obstruction, infection, or damage to the middle ear or to the auditory nerve? So we have to figure out what is causing the damage and what their abilities are with it. We will go ahead and make sure we can increase their hearing ability and maximize their communication. We may do that with whiteboards. We may do that with pictures. We may do that with really focusing in and talking slower to the patient. Make sure there's no background noise. Focus on safety and ADLs. Are they safe to be home by themselves? I mean, they're up, they're able to do everything, but they can't hear the doorbell. Is that a problem? They can't hear somebody's breaking in their house. What they can do is have the doorbell connected, or if the phone rings, they can go ahead and they can have it set so that their lights will flash for them. So they will see the light flash if they're awake. Okay, so there's different ways that we can make up for the hearing with using a different sense. Give them the best education and their resources. You know, that may be different support groups or things online, different things that they can do. Have at least partial hearing improvement. That would be nice to have some, minimize their anxiety. We can do an anti-anxiety or make up some ways that they can help compensate. All right, case study. Let's see what you think. What do you think is our best answer? This is almost a side question, right? What do you guys think? Shout it out. C. It's the nicest answer. So that would be our most appropriate. Doesn't mean you're not going to think some of those too somewhat, but yes. C, it must feel frightening to think about losing your hearing. Why don't you believe your daughters? They're going to get defensive. Everyone worries about losing their hearing. Why is that not going to work? Because that means you've lost your hearing, you know, without letting them come up with that answer. All right, case study 2, suspected hearing loss. What is most important in our ear, or select all that apply? A, exposure to loud music or other noises, is that important? Huh? No, just kidding. Use cotton swabs to clean your ear canal after every shower. No. Nothing smaller than a fingertip should be inserted into the ear canal. That is correct. Use an ear irrigation syringe to remove built-up earwax. It can be done. Earplugs should be used when engaging in all water sports to avoid infection. Not a bad idea. Not a bad idea at all. And just so you know, you can get some really great earplugs. They can make them for you up to like $250 or so. Good ones that will really go in, stay in. When you've had so many, I remember after insurance 28 years ago probably, it was still like $150 for these earplugs, but I needed them for little boys that wouldn't stay out of water that had had so many ear issues. But you have to go and they have to make the molds and they have to squirt this stuff, you know. It becomes quite a process, but there's a lot of things they can do. Patient's daughter asks what she can do to better communicate with her mother. What would you provide? Anybody? Which one? D, I think, is the best answer. Do you guys have the answers in front of you? Oh, gee whiz, then D. Come on, let's go quicker. Case study, a week later, patient's hearing is tested by audiometry. She needs hearing aid. Which patient's statement indicates the need for additional nursing teaching? A. I would look at that question again. You might see it again, something like it. Okay. Nurse understands that a patient with a long history of heart failure is at risk for developing hearing loss if what's the answer they give you? C? C, furosemide, yes. Typically, with the topical medications, that won't cause the ototoxic, won't be ototoxic. We do know that there's a genetic component, but lots of Lasix is a problem because it's a diuretic that we talked about, and then that's usually systemic versus topical. All right, priority nursing intervention with the person with hearing loss. What's the answer? What's that? A. Create the safe environment so that you can do all the things. So you can repeat things, so you can directly visualize. Provide written. Right external ear is deformed. What do you want to ask for? Or check for? What's the answer they give you? Whew. You heard that in lecture today, right? All right. We made it through that one. Made it through ears. Any other questions that you have for me on that one?